All right, thanks everyone. Good afternoon. I'm excited to co-present work done by my co-authors Sylvia, Simioni, and Xuecong, who's unfortunately unable to be here today. So online shopping is pervasive, and recent predictions suggest that consumers could spend up to $100 billion annually by 2022 or 2024 on online grocery shopping alone. However, the majority of the users of such services tend to be highly educated, affluent, and technically adept. While online grocery shopping can create numerous societal opportunities such as improved equity, it is unknown how beneficial these services are or could be among users who are traditionally underrepresented in such services. Online grocery delivery services present new opportunities to address food disparities, especially for those individuals living in transportation-scarce and low-income areas. These individuals often face difficulties in maintaining a healthy diet, not only because of the lack of their financial resources, but the presence of food deserts or urban and suburban areas with limited access to supermarkets. Such areas often have easier access to convenience stores and fast food restaurants than healthier options, leaving residents in these areas with limited access to healthy food. Therefore, to build on the growing thread of research to understand opportunities for technology to address limited access to transportation and healthy food among such communities, we posed 3 research questions. First, does the online grocery delivery model serve as a feasible model to provide healthy food access to low-income and transportation-scarce individuals? Why or why not? Secondly, does an online grocery delivery service lead to healthier food choices? Why or why not? Finally, what opportunities exist for online grocery delivery service design to support healthy choices among individuals living in low-income and transportation-scarce environments? Because we are limited on time and because we were unable to gain statistical power in addressing our second question, we will address the first and third research questions in today's talk. However, we encourage you to read our paper because our preliminary results suggest, yes, online grocery delivery services could lead to healthier food choices. And we propose opportunities for the community to conduct further research in this area. First, I'll quickly discuss the online grocery delivery service that we selected, Shipt. Shipt is a Target-owned internet-based grocery delivery service that allows users to place orders on items sold by major retailers such as Meijer and Target. The service offers same-day delivery, and we selected Shipt because of its availability in southeastern Michigan. At $14 per month, it also had the most affordable membership compared to similar services such as Instacart and Amazon Fresh, and we knew from our past work that cost was a facilitator to the use of emerging technologies. So once you join the service, you can select available major retailers in your area. In the case of our participants, Meijer and Target. You're then able to browse and order groceries. You can interact with shoppers if problems arise before receiving your delivery. Note that there's a free delivery on everything over $35, and this is US dollars. Otherwise, you have to pay about $7 per delivery. You then rate the shopper based on his or her performance. For context, our study took place in southeastern Michigan and primarily metropolitan Detroit, which offers a rich opportunity for understanding and addressing transportation challenges. In fact, as we'll discuss in our session on Thursday, this is the reflection session, 36% of census tracts in Detroit have been designated as food deserts by the US government. We recruited participants with limited access to transportation, who lived in the urban area of southeastern Michigan, and who felt comfortable making purchases online. To aid in our recruiting, we drew from our prior research that suggests the use of trusted organizations to recruit in low-resource contexts. Therefore, we recruited from local workforce development programs. We also circulated advertisements through mailing lists, library bulletin boards, community centers, and at bus stops. This ensured the likelihood that we would be recruiting from low-resource contexts and in transportation-scarce regions. We also used snowball sampling. So we conducted a pilot study which consisted of a controlled field experiment. To conduct this experiment, we randomly assigned 20 participants to either the Shipt group or the control group. We onboarded Shipt participants to use the online grocery delivery application, Shipt, for 1 month. We instructed the remaining individuals to save their grocery receipts for 1 month. We then collected receipts from the non-ship group to compare food purchases with the orders from the ship participants. Finally, we conducted our interviews at the end of the pilot experiment, which were recorded and transcribed. We interviewed ship participants to understand their experience using the application and service to get a sense of how feasible the service was. We asked our ship and non-ship participants questions to learn about their purchase patterns and general questions about their grocery shopping routines, including where they shopped and how they got there. Note that we compensated those in the ship group by paying for 1 month membership. Again, this was $14 at the time. We also preloaded their accounts with a $50 credit, which also removed the need for participants to have credit cards. We compensated non-ship members $64, or the equivalent of the credit card and cost of membership, in cash after they completed their exit interviews. So our data included field notes taken during the recruitment process, interview transcripts, our ship participants' online shopping history, and our control group's participant receipts, which again we don't discuss in our presentation, but we do in our paper. And finally, we collected demographic surveys. Note that the average income and race of our participants was consistent with that of the city of Detroit. Participants on average had a yearly income of $21,000 US, and they were predominantly of African American descent. Our participants' average age was 49, and 3 participants reported a disability. Now I'm going to turn it over to Sylvia to discuss the results.
To begin, we use our interview results to determine whether our online delivery model enables access to healthy food in regions that are low-resourced. Upon being interviewed, all participants chose their own pseudonym, by which we refer to them in the paper and our talk. We found 4 factors that elucidate the benefits and barriers the service brings to this community. Let's focus on the good first. Participants in the shipped group liked the service for its convenience and accessibility. Compared to the control participants, their purchases were quicker, they shopped more frequently, and they found the app allowed for fresh food options and eliminated the need for travel. One participant with a physical disability reported difficulty going up and down the stairs. She was especially satisfied because the service allowed her to get groceries delivered right to her door. The second positive factor was the service reliability and quality offered by the delivery model. This speaks to the outstanding service provided by the shoppers that pick and deliver. Our participant Rachel, for instance, enjoyed staying in touch with her shopper Shalonda to substitute items that weren't in stock. Participants appreciated shoppers' cordiality and, above all, their attention to detail. But worth noting is that all of our participants care deeply about the ability to see, touch, and select fresh food items. Lovebug says, "I believe they will pick the best, the person that's picking the groceries and stuff, but it's not like you're picking it yourself." I think most of us can agree with that. Yet our participants are extra cautious because of their prior experiences in finding at their nearest stores meat and produce that doesn't meet their standards. As Keisha says, "It's hard shopping at the markets in my area. A lot of the stuff is outdated. You have to watch out for the expiration dates, the freshness, the cleanliness of the markets. A lot of them aren't up to code." Based on the receipts we collected, we learned that 50% of the stores where participants shopped were either local slaughterhouses or the farmers market, which is to say, places where they're willing to go out of their way to get fresh items, or dollar stores, gas stations, and convenience shops that are closer but offer a limited stock. So, despite our ship participants showing some reluctance about having a shopper select on their behalf, this did not stop them from buying items that are fresh on the app. Overall, participants in this group were pleased with their shoppers and the quality of their groceries. However, there are 2 major aspects of the grocery delivery model that hindered its feasibility. Even though we gave participants in the ship group a credit to buy groceries during the study, they immediately noted issues with incompatible payment methods that would prevent them from using shipped in the future. Participants from both groups showed they used the electronic benefits transfer card to receive federal nutrition assistance that they may swipe at most brick-and-mortar stores. Yet this method is not supported by the service. However, I want to focus primarily on the limited social interaction noted by our participants. Obviously, grocery delivery apps inherently remove the social experience of shopping in person. Rachel, our most senior participant, said that grocery shopping was an opportunity to get moving and stay physically active. It also supports the value of connection and, at times, friendship. Rachel said it best. "When we were kids, shopping was an experience. I remember getting dressed up to go downtown. Kids now lose out on so much because, you get together with your sisters or your friends and you go shopping and you have an experience. That's what is missing when you do online shopping. Loyalty is another social value our participants observe, particularly when it comes to the experience of shopping in person. Some of our findings suggest that this community is loyal to local specialty stores like meat markets that offer grade A or halal items. Rosemary said that she managed to get her whole family to shop at one of the specialty meat markets because, quote, it's the best meat and the taste is totally different from any store. Our interviews indicate there is a link between social communion and the desire to access fresh, healthy food. Finally, we present key points from our discussion to answer our third question and explore opportunities for design to support the health of communities with low income and scarce transportation. Today, I will be focusing on two, and I encourage you to check out our paper for further insights. I want to highlight briefly the aspect of access, drawing upon research from Walker et al. On disparities found in food deserts. We know that the addition of a new, more expensive health food store in town will not necessarily mean that residents will flock to it. People instead tend to remain loyal to the current stores because they are familiar and affordable. Likewise, we found in our study that when they have a chance, participants will go to the stores where they can find the best meat, the best produce. To mitigate the risk of grocery chains putting these smaller stores at risk, we recommend online delivery services to partner with local vendors. We also recognize the importance of cultural values when designing interventions to encourage healthy eating. In our paper, you can find receipt data from both participant groups that suggest that users in the SHIP group bought a higher percentage of healthy items, even though many of them reported their shopping habits remained more or less the same. Perception of what it means to eat healthy can be largely cultural. According to James in 2004, folks of African American descent may view eating healthy as giving up on their cultural heritage and conforming to the dominant culture. Plus, in HCI, research from Parker and Grinter in 2014 shows that health systems ought to consider the valued collectivism that is deeply embedded within the African American community. We find that HCI is an appropriate space to build on this population's sense of community while engendering positive health behaviors, but only if it accounts for their nuanced traditions, their norms of communication, and their ancestral beliefs in consuming food for soulful nourishment. Soul food, after all, is extremely delicious and gives us dishes like macaroni and cheese, fried chicken, and collard greens that we love in the United States, but know are high in fat and calories. We therefore suggest the option for online services to promote healthy recipes and selection behaviors that are based not only on individuals' past purchases, but those of their community. Pairing these guidelines with digital coupons and Seek et al.'s suggestion to provide users with meaningful and actionable advice may boost perceptions of affordability and health empowerment. In summary, we conducted a pilot experiment with 20 individuals living in low-resource areas to understand the feasibility of online grocery delivery services and enabling access to healthy food. We found the model does work in offering convenience, accessibility, service reliability, and food quality to our participants. Although we have discussed policy and design opportunities to address issues with limited social interaction by accounting for loyalty to local health food vendors and supporting other community values with culture-conscious health strategies. Our work provides implications for how the Kai community can design online grocery delivery services that better meet the needs of populations in food deserts, and paves forward paths for researching how design interventions may lead to sustained positive health behaviors over time. And lastly, we would like to thank the National Science Foundation for their funding support, as well as Jacob Berman, the Social Innovations Group, and Michigan Interactive and Social Computing for their feedback. Thank you, and I'm happy to take your questions.
For questions, please use the microphones next to the doors, or raise your hand if you can't get to the microphone.
Hey, my name is Andy War. I'm from Uber. One of the products I actually work on is Uber Eats. And when we're actually studying grocery delivery, food delivery a lot, there's an interesting dynamic when you have a multi-sided marketplace. And I was wondering, and when I say multi-sided marketplace, I mean you have the consumer who is getting delivery, but then also the food vendors who are providing that, the shoppers who might be shopping for it, and then also the people who might be doing the delivery. I was wondering, how did this come into account with the study that you were conducting here?
Thank you. Is Andy? Thanks, Andy, for your question. So I'm going to repeat, for live stream. So you're asking about the additional stakeholders that are involved in this process. How do they come into place? So we do acknowledge a limitation in our study. The shopper is one stakeholder that we weren't able to interact with, and we believe, it might be interesting to explore how these shoppers are being rated. These are their jobs. But I think the implication for the stores is a sense of loyalty, which Sylvia mentioned in her segment of the presentation, because a lot of people are loyal to certain stores, and if these stores aren't participating, then it's hard for them to maintain that loyalty. So I guess from an Uber Eats perspective, I'm not quite sure how these third party, how they're involved, right? How do they sign up, or how do they engage? But at least for our populations, I would encourage you all, if you have the ability, to go to these local vendors and see if they would be interested in participating, because we did that sense of loyalty did show up. And there was one more stakeholder. Our study looked at the shoppers themselves, right? And so what you hear in this presentation is that perspective.
Hey, Dan Cosley, Cornell. So I'm trying to think about how much of the benefit from the point of view of the participants was about positive health behaviors and healthy eating, and how much of it was sort of about convenience and experience, right? Because what you presented, a lot of it was more about the experience than the healthy eating, and so I was just wondering if you could talk a little more about any parts that were about the healthiness. I mean, obviously access to better food than is available locally, right? That's a dimension of healthy. But do they talk about other parts of it?
Yes. So in our paper, when we further explored the second research question, the aspect of impulse buying came into effect, especially when purchasing in brick and mortar stores. We had one participant who said that the experience with shopping online actually limited those impulse buying habits, which enabled her to purchase healthier food items as opposed to being at a checkout line. We were prone to being more distracted. So yes, we did have some evidence of that in our paper.
Okay.
Thank you.
Oh, sorry. Did you have any more about how many of the people were in caregiving relationships, right? Because I have a 3-year-old now, and my experience of grocery shopping is very different than it used to be, right? And so I was wondering if that was part of how people were thinking about it.
Yes. So earlier in our demographic slides, let me see if I can. Did we? I don't think so. Did we? Okay. Oh. So the number of dependents the average number of dependents in our study per participant was about 2. So the impact of children was not necessarily as potent in our research, but we have explored how the effect of children can affect the process, and it is unclear whether they either enable certain negative health behaviors or hinder them. So.
We have time for one quick question. I guess I'll ask it. You talked about customization and cultural recipes being relevant. Did you find any tensions with the vendors in that aspect, and maybe their needs in terms of having to customize food to different communities and so on?
No, we did not find any tensions with the vendors. We also did not have the opportunity to interact with them. Yeah.
Do you foresee that would be a problem?
I don't think so. If they would be in the interest of catering to this community that has their particular cultural customs, I think it would be in their marketing interest to do so. Thank you.
Let's think.